Hello, maayong adlaw sa inyong tanan. Kami ang Group 2 sa NSTP and karon i-perform na mo ang CPR or Cardiopulmonary Resuscitation. I am Rachel Tan Velasquez.
I am April Mary T. Padilla.
And I am Yasen Bonza.
Hala, nanalunod! Ma'am, nanalunod, ma'am! So karon i-perform na mo unsaon pag CPR pag naay mga nalunod. So karon dinhi ang ato ang nalunod ganina ug natay sa rescuer perform nila kung unsaon pag CPR or Cardiopulmonary Resuscitation. Tara, uban nimi. First thing natong buhaton is magpaila-ila ta, introduce yourself or ask for consent before checking the patient. But when the patient is above 18, dili na nato kailangan mag-ask og consent. We can automatically perform the CPR. But first, introduce yourself like, Hi, my name is April and I am a trained first aider. Can I help?
Hey, are you okay? Hey, are you okay?
The patient is unresponsive or the patient is unconscious. Next thing to do is to ask someone para magtawag og 911.
Please call 911.
Once nakahatag na tag instruction or nagpoint na tag someone to call for 911, the next thing to do is to check the patient's ABC or the airway, breathing, and circulation. Since the patient is unresponsive or unconscious, next thing to do is to check for ABC. First is to check for airway. Place your ear next the person's mouth and listen for no more than 10 seconds. Observe the rise and fall of the patient's tummy and place your two finger to check for carotid pulse. The airway is the first component of the ABCs and is crucial for ensuring that oxygen can flow freely into the lungs and carbon dioxide can be expelled from the body.
1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Patient has no breathing and no pulse.
Since ang atong pasyente has no pulse and not breathing, our first aider here will now perform the CPR or the Cardiopulmonary Resuscitation.
Okay, we will now perform CPR.
If you do not hear breathing or you only hear occasional gasp, begin CPR. First is to position yourself. You have to kneel between the shoulder of the patient. Place one of your hand on the top of the other hand and clasp them together. With the heel of the hand and straight elbow, push hard and fast in the center of the chest slightly below the nipples. Push at least 2 inches deep. Compress the chest at a rate of 100 times per minute. Let the chest rise fully between compression.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, and 9, 10.
The next thing to do is to perform 2 rescue breaths. Making sure their mouth is clear, tilt their head back slightly and lift their chin. Pinch their nose shut. Place your mouth fully over theirs and blow to make their chest rise. If their chest does not rise with the first breath, tilt their head. If their chest still does not rise with the second breath, the person might be choking. After giving the full blow, and dili pagyapon responsive ang atong patient, you have to repeat the cycle of 30 chest compression and 2 rescue breath until the person starts breathing or help arrive. Even if the individual is breathing but is unconscious, there is still a significant risk of airway obstruction. The recovery position reduces the risk to the patient. Putting them in this position with their head back helps keep their airway open. It ensures their tongue falls toward and the blood and vomit drains out. Dili man siya 100% perfect ang among performance, but hopefully you learn something from it kung unsaon pag CPR. And you have to remember always, dili ta pwede mag CPR if dili ta first aid trainer, if wala ta na train and if wala ta sa position. Okay? You have to remember always na being a first aid is very important and doing the CPR is very crucial. So, karon hopefully nag-enjoy mo kasi napay makasulti akong mga kauban.
Kanang basic first aid like CPR saves lives. So needed jud siya kaayo nga ato na siyang mahibaluan.
Yes. So kung naay mga free nga trainings, i-grab jud ninyo siya, and kung unsa pa yung gusto mahibaw-an, you can always ask. Pwede ninyo siya i-YouTube, i-Google ninyo siya for more information. And hopefully, namoy nakatunan sa amo ang video karon. Thank you and bye-bye.